Here we go. Management of patients with upper respiratory tract disorders. So, upper respiratory tract disorders affect the nose, paranasal sinuses, pharynx, larynx, trachea, and bronchi. These disorders, such as the common cold, allergies, are relatively minor and the effects lead to mild and temporary discomfort and inconvenience. However, upper respiratory infections can lead to more serious, acute, and even life-threatening conditions. Upper respiratory infections are the most common and affect most people on most occasions. These infections can be acute, lasting several days, or chronic, lasting for weeks or months, and they may reoccur. The common cold is the most frequently occurring upper respiratory infection that is caused by viruses that are inhaled. It is important as nurses that we recognize through assessment the severity of these infections because early detection and early intervention can lead to less complications, right? These types of illnesses are treated in all areas of healthcare, but most commonly in our community settings. Patient teaching on prevention along with health promotion are the best ways to reduce infections and reduce the spread of these infections. Please take a look at your chart in the chapter in your MedSurg book that talks about special considerations for upper respiratory infections, especially for the older adult. It goes into some pretty good information. Okay, rhinitis is a group of disorders that causes inflammation and irritation of the mucous membranes of the nose and contributes to sinus, ear, and sleep problems. Rhinitis can be acute or it can be chronic and is caused by inhalants. It can be allergic, it can be due to allergens that cause like dust, pollens, those kinds of things, or it could be a non-allergic form of rhinitis where microorganisms like viruses or bacteria are actually causing that, right? Most medications can cause rhinitis too. I shouldn't say most. Some medications can also cause rhinitis through their side effects, like, for example, ACE inhibitors or even beta blockers, right? They can cause rhinitis. And then pharyngitis is an irritation of the throat manifested by redness and inflammation. This condition can be acute or chronic. Viruses cause most of the acute infections. The inflammation causes pain. Rest and comfort measures are employed, such as cool or warm beverages for comfort. Change to soft foods to avoid irritation of the throat. We'll give the patient analgesic medications that can be used for pain. Chronic pharyngitis is persistent and can be seen in individuals who work in dusty areas, right? Or patients who use their voice to excess, patients who have chronic cough, or habitual alcohol or tobacco users have trouble with this as well. Recommendations to reduce exposure or wear a mask is encouraged. We encourage these patients to drink plenty of water, sometimes the doctor will prescribe them gargling with warm saline solutions because that helps relieve discomfort for them. Tonsillitis and adenoiditis are enlargement or irritation or inflammation of the lymphatic tissue situated on each side of the oral pharynx. Symptoms of tonsillitis and adenoiditis include sore throat, fever, difficulty swallowing, and snoring. Diagnosis to determine viral or bacterial is done with a swab or a culture of the throat. If bacterial, the infection can be treated with antibiotics. Supportive treatment includes increasing fluid intake, taking analgesics, doing saltwater goggles, and of course rest. Chronic tonsillitis or adenoiditis can lead to tonsillectomy and can include the adenoids as well. Surgery is generally conducted outpatient. Laryngitis can be caused by the same pathogens that cause pharyngitis and also can be caused by environmental pollutants. So again, laryngitis can be caused by environmental pollutants or the same pathogen that causes pharyngitis. Vocal cord infections and GERD can also cause laryngitis. So many times patients who have GERD, it will lead to, laryngitis. So they get that hoarseness, they lose their voice, that aphonia, they may end up with a severe cough. So it's important that they rest their voice. They want, they need to avoid environmental pollutants. They need to maintain a humidified environment. So we're going to encourage them again to get humidification. We're going to increase their fluids. We're also going to probably encourage them to use expectorants that will help loosen secretions, things like that. Ooh, here's a good picture. That's what it looks like. Awesome. These pictures show the effect of pharyngitis in the throat. That inflammation causes the redness and the swelling that you see there on the right-hand side, right? And that's what's causing the pain in their throat. Okay, upper respiratory potential complications. So, complications of upper respiratory infections include airway compromise from obstruction such as mucus or inflammatory causes, spread of infection to other areas of the body, which can lead to sepsis, spread of infection from the sinus cavity to the brain, which can lead to meningitis. Other infections can be ear infections or worsening infection that spreads to the lungs. We can end up with nasal congestion that is triggered by an overuse of decongestants. That's why we got to tell patients who use those intranasal decongestants to use them sparingly, because they really can trigger nasal congestion. Medicamenosa, you don't need to know that word, but it can lead to that, which is this continual swelling and congestion of the nasal passages if they overuse those nasal decongestants. So patients can have difficulty with speech or their voice, causing, a major communication barrier too. Assessment. So nursing assessment includes a full health history. This will help determine the changes, and it also establishes like when the symptoms started, right, the onset of symptoms, along with the patient's baseline. We always want to know what their baseline is. Notations of signs and symptoms, allergies to help determine factors that could be contributing to their illness, as well as a physical inspection of the mucosa, and noting any changes to the mucosal areas or any other physical changes, right? So all of that's going to be your nursing assessment for this patient. This slide has some really good nursing diagnoses that accompany the upper respiratory infections. Please pause the video and make some note cards from it. Here are interventions for individuals with URIs. So we want to protect them, protect the safety, comfort. We need to elevate the head, helps with airway management. It also promotes drainage of the mucosal areas and deters aspiration, right? We might use what's called an ice collar that's placed around the throat and neck to reduce inflammation and reduce vasoconstriction. It reduces the inflammation and causes vasoconstriction, which helps reduce bleeding if that were to occur. So again, I'm going to repeat that. Ice collars are put around the throat and neck to reduce inflammation and cause vasoconstriction, which will help reduce bleeding if that were to occur in the area. Heat can help with congestion. Analgesics for pain, saltwater goggles to reduce mucus by removing the irritants that help, with pain, and it also loosens up the crusted secretions that are occurring. What else? Alternate ways to communicate may be necessary if your patient is experiencing loss of voice or difficulty speaking. We want to encourage fluids, very, very important, because hydration loosens mucus and makes it easier to get rid of or expectorate. We want to also make the diet soft, bland to help the patient maintain nutrition, but with much less pain. When it hurts every time you eat, they're not going to eat, right? And of course, we want to make sure they get plenty of rest. That's very important for healing too. Evaluation. So our evaluative process is an improvement and reduction of symptoms through compliance of interventions, right? Literally. And the last slide. Patient education includes prevention, such as frequent hand hygiene, changes to environment to reduce contact with irritants, and the importance of taking their annual vaccinations. If your patient is taking antibiotics, it's important they know to complete the full medication regimen and not stop taking it when they feel better. I know that sounds common sense, but it is not for many, many patients. It's also important to inform your patient that they need to seek further medical treatment if their symptoms persist or get worse or they spike a fever. They should not, so if they do, they need to come back in right away. Don't wait till the full course of the antibiotics. All right, this is the end of the chapter.